Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. We are joined today by Lisa Curbow. Welcome to our podcast, Lisa. Thank you so much for joining us. And I have as my co host today, Nicole. So, not my usual Joffrey sidekick. So, I'm excited to have a new, fresh perspective with me here today on the podcast.
I'm
So,
excited to be here. I'm excited to do our first episode together and get to know
yes.
Lisa a little bit more. Her story is really, really cool and exciting, and she always has great stuff to say. So I'm excited.
All
And thanks for
right.
having
Well,
me.
we're grateful that you are spending your evening with us. So, well, with that being said, Lisa, we'll kind of just start with your journey as a hygienist. How did you get into dentistry? What brought you to where you're at right now? So, tell us that basic story.
Well, I started out as an assistant 28 years ago. So doing that for a little while. And I'd kind of thought about dental hygiene, but my mom said, I don't know if you really want to do that. I don't know if they have good hours or make very good money. So I don't know. And so I started as an assistant and was working with one of my friends as a hygienist. And she's like, no, I think this is where you need to be. And so I applied and I got in on the first try, which is not very common. So I took that to mean, yes, that's the place I was supposed to be. So I graduated 25 years ago. I've been a hygienist a little over 25 years and worked in general practices, mostly general practices. I've worked in perio, but this last practice that I've been at, and I've been there 18 years, we see a lot of special needs. And so it's just, everything's kind of morphed that way.
That's interesting. Okay, my bestie in hygiene school, Elmer Gonzalez, did a lot. So while we were in hygiene school, he would work graveyards and he worked at a nonprofit called Adelante. And it was care and not dental care, but just general care in like these group settings for special needs patients.
Okay.
And I want to say while he was in his master's program, he worked with a clinic there at Carrie Tingley, I want to say hospital with the University of New Mexico. And he pretty much always had special needs patients. And that is such a gifting and so much patience. So how did that kind of lead you there? I mean, you said you were worked at Perio, and
Mhm.
then how is this practice like known for special needs? Is it like your
It is
doctor
now.
is kind of did your doctor just kind of gain a specialty, or what was that like?
Well, so I mean, ADHD is part of it. So I've always had somebody, and then my oldest has Asperger's, which is now ASD1. So that gave me kind of a heart for it. I have a nephew that also has ASD1 as well. So there's just some in the family, and I had a patient probably, I guess I started seeing him maybe 15, 16 years ago, and he's got a lot of issues. He can't see well, he can't hear well, he doesn't speak. And so they got him established with me, and they're like, let's keep him with you. You figured it out. And every time I saw him, I saw something different. What do I need to do? What's going to work now? What didn't work last time? And so that just kind of morphed into, well, you did well with him. Maybe this other person will come in and maybe you can use some of the same things. And then we started seeing more and more. And my doctor has a big heart for special needs as well. And that's just part of kind of their family that they have some special needs. His wife works with special needs in the school district. So there's a real heart for it.
Mm-hmm.
So they sent a few other people our way. The pedodontists did when they found out we had hospital rights. So that's the kicker, is we have hospital rights. So the doctor can go to the hospital and under sedation see these patients. So once the pediatric dentist found that out, he started sending some our way, and they went well, and he started sending more and more. And then those families talk to other families that talk to other families, and they get on their forums. And so, yeah, a lot of people know that we do that now. So I get several every week.
That's so cool. I know I worked pedo for a while when it was one of my first jobs outside of assisting school. And I just remember they papoosed every special needs patient for the
Yes.
most part.
Yeah.
And that scared the living daylights out of me. I did not like that. I felt so
Yeah.
terrible strapping these people down and just forcefully doing work. I didn't end up staying there very long, but that's how things were done, back then, before we knew, this is 15 plus years ago, now we know how to handle these situations a little bit better. And I know, you and I had been talking on social media for a while, and I finally got to meet you at Under One Roof, which was fantastic. And you and I had this conversation, and a lot of what you had said to me really just kind of like stuck in my brain. It was just like little tidbits that probably are just things you say on a day-to-day basis, but things I had never thought about. Stuff like, if someone's coming in, whatever you're able to do that day, they're leaving better than how they came. That was a real big thing that stuck with me. And just kind of learning all these different tips and tricks and learning ways to handle difficult situations. How did you kind of do that? What were the ways that you found to best handle all these different types of special needs?
Well, it started with the one boy, and like I said, he's not even a boy anymore, but it started with what worked well for him, finding out that, like, okay, he's got a lot of spasticity. So on this side, I could use the mirror. When I got to the other side, that didn't work at all. Like, I couldn't see a thing. So I figured out if I hooked my thumb in, he would relax and I could move back. Then as I also did a lot of continuing education. I'm part of the Special Care Dentistry Association, so I've learned some from them as well. But one thing I had learned was deeper pressure, especially if they have a lot of spasticity, actually feels good to them and can relax that. So I tried it on his. I already had my finger in his mouth. So I pressed right here and just put, it doesn't hurt. It's just a little deeper pressure, not a light pressure. When I did that, he relaxed even more. And so, in fact, his mom came to me probably the time before last when I cleaned him. She goes, the GI people want to know how y'all look in his mouth because they can't look in his mouth. I was like, put your thumb in his mouth, put some pressure, and he will just open right up for you. So even his parents who are brushing his teeth every day don't know it all. So it's a lot of trial and error. But sometimes what you learn on one person, you can translate to another and try it. And sometimes it works. So I hate to say everything is trial and error, but it really is because their needs are so unique and every one of them is different. Light pressure on one may physically hurt because if they have sensory issues for pressure and touch, it may physically hurt them, whereas that deeper pressure feels comforting to them. So like lead aprons feel good on them, weighted blankets, weighted lap pads, compression vests, things like that actually comfort them. So it's a lot of trial and error, but a lot of times when you've done it for a while, you start to learn, you can just tell by their reaction when you show them something or say something to them, go, that's probably not going to work. So let's move on to something else. I had one not that long ago, and it's like, well, if we can take x-rays, great. Let's start with pictures. Pictures are a whole lot easier, and you get them involved, and they see their teeth, and they get excited, and like, oh, that is my teeth. I can see my teeth because I always point them to the screen so that they can see it. And sometimes then I can move on to x-rays. But one the other day, no, there was no way. I got the pictures, and when it came time for that, nothing was happening. It's like, we're not going to push. Why push? Why push really hard when we have the ability to take them to the hospital and put them under sedation and do the full series of x-rays, full cleaning, full exam, any fillings we need to do, or I can torture them here and only to find out I still got to send them to the hospital. So there's just no point.
And create such a bad experience and such you lose any rapport that you might have. So no, I'm totally with you on that.
Yeah.
I'm curious what, like, knowing those, like what happened at that appointment and what worked, like what would your note template look like for each patient? Like, do you have special, like, this is what worked here, like a menu, or just
no, it's I just have to individually do it, and they're long. They're usually pretty long. Well, sometimes I guess they're short when I just say nothing I did worked. But most of the time I'll say, like, all the normal stuff that you put in there, what we could do. And then I'll say, like if I was trying to take x-rays, patient could not cooperate, patient could not open, patient could open on the right side, but patient couldn't bite down. I put quite a few notes usually in the first time that I see them, so I don't have to rewrite it every time. I'll go back to that. Most of the time I see them first, and because I have two other hygienists, so I see them first, and if they were able to cooperate in the chair, we could get pretty much everything done. Then I may have them see one of the other hygienists. If it was a struggle, it takes extra time, then I'll probably continue to see them. Or if the parents are like, we've got to establish him with one person, then they'll usually establish with me. So That way they get some consistency. And I have kind of a weird schedule where I have certain days that, because I'm also the office manager. So on my office days, that's where I put my special needs patients so I can spend as much time as they need. And then I just finish my work, after hours or whatever. But if I need an hour and a half, I have an hour and a half. And whereas you can't do that in a regular schedule. But once I figure out what they need the first time, I know where they're going to fit the next time. I can say, oh, from now on, they're an hour patient. It's fine. Or, you know what, all they're going to be is they're going to come in, we're going to maybe take a photo or two, and the doctor's going to do a quick look, and then they're going to go to the hospital once a year, once every 18 months. It just it varies from person to person. I put all of that in my notes so that they can see the next person. If they do see them, they can see, what did I do? What was successful? A lot of times they'll still come to me and go, okay, tell me real quick, what did you do? What worked? What were you able to do? But the biggest thing is that, like I told Nicole, the mindset of anything you can do is better than what they came in with. We have the mindset of perfection. You bring them in, you've got to get every last bit of everything on their teeth, or you didn't do a good job. But in their case, you don't. It's not that you don't want to do that, but you want to work within their needs or their abilities. And if they can't tolerate that, but you could get most of it scaled or all of it polished with a little bit of scaling, that's more than half the time that their parents are able to get it home. So I even talked to one of the pedodontists about it, and he said the exact same thing. He said, we have to change our mindset of anything we can do is better than they came in with. So that way we're not just beating ourselves up going, I didn't scale the distal of 30. Couldn't even see it. But you do what you can do to try to help them out as often as you can, and see them more often if you can. A lot of times they're limited by their insurance or their Medicaid or whatever that they have. But sometimes we tell the parents we really need to see them more often, and they can usually work out an extra cleaning into their budget if they know ahead of time.
No,
Where are
I
you
think
based
that's
out
helpful.
of? Oh.
Sorry, say that again.
I was just wondering where you're based out of.
I'm in East Texas.
What part?
So if you know where Dallas is, and you know where Shreveport, Louisiana is,
Shreveport.
I am smack in the middle. So I'm 100 miles from Dallas and about 90-ish miles from Shreveport. So we are right straight down I-20.
Okay, this is off subject. Are you by Round Top?
No.
Oh,
no.
okay.
Round Top is further
Okay.
west and further down. So I'm in Tyler, and Tyler is the
Tyler.
rose capital of the world. So some people know that, some don't. It's not that big, but some people know it.
I've actually been there because my son's name is Tyler, and we were driving through, and I was like, "Oh, there's a place called Tyler." So we stopped and took a picture.
Yeah, that's us.
I love that you have found a place that you have kind of flourished. Like, this is an unconventional story.
Yeah.
Like, you weren't seeking this specialty, if you will, and your doctor doesn't seem like they were necessarily seeking it out either.
No.
But you guys all just kind of had a heart for this population.
Yeah.
And who's going to take care of them? So I think this is amazing. And the satisfaction, I'm sure the physical fatigue that you go through in the day is immeasurable. But I think the satisfaction that you get from the parents just being so grateful, and the family members for care that you can give them that they can't give.
We have them coming from, I have one that's from nearly Austin. So that Austin's 4.5 hours away from us. And they come from the Louisiana border, and they come from, I have some coming from Arkansas. So I've got them driving 2, 3, 4 hours because they can't find anything. There's a lot in Dallas, but so many of them do not want to do Dallas. The traffic is so bad up there. They try to avoid it, but and they don't want to do chains. And a lot of chains don't. There are some really good places up there that we refer to because they're still past what we can do. Or our hospital can't do them because our hospital is outpatient, and they may need the safety of the ability to go inpatient if something goes wrong. And so we send those to Dallas. There's still some place we have to send them up there sometimes, but it's very tiring. I'm very I feel sweaty and hot when I'm done. But at the same time, it's like, oh, I got them clean, especially when the parents say no one's ever been able to do that before.
Yeah.
Then it's like, yes, I did something for them. I had one not that long ago, new patient, a little Down syndrome girl. I was able to do most everything to her, and she came up at the end and she gave me a hug, and her mom was just jaw dropped, and she said she only hugs family. She never hugs anyone else. She goes, "You must be some kind of angel." And I'm like, "Oh, thank you."
Oh,
So I just, to me, that meant that she knew that I was there to help her and she wasn't scared of me. And that was a big deal. That I don't want them to be scared of me. I want to help them. I want them to be more used to coming to the office. Some you will never be able to. You will never be able to desensitize them to get them adjusted to the office. But if you can take one that they've never been able to have in the office treatment and now they can, you've helped one. You've kept them from having to go to the hospital, having general sedation, and you can see them every 6 months. So it just brings me a lot of joy, and I feel blessed that I could help them.
I think that's so rewarding, and you've kind of
Yeah.
made this like Amanda was saying, this new specialty that you've kind of got put into and seems like you were meant to be a part of, but you've done this also where you can educate other hygienists in how to help people in these ways. And I know that you've done some speaking events and things like that. So how did you take your knowledge based off of what you do clinically and turn it into something that you can now speak and write about? How did that journey look for you?
I've always thought I wanted to speak, but it was like, what am I going to speak on that everybody hasn't heard before? It was like one dental rep said, "Oh, you could speak on anything. You could find anything you like." I was like, okay, it's all been done before. It's all been said before. I'm nothing special. I have nothing special. And then this just kind of developed, and it's like, you know what? Look what I've been able to do. That if I could get more people to just try the things that I've tried, to know what I've learned, then maybe they can start seeing them in their offices as well. And it just spreads it out and makes it where there's more availability. There's so limited amount of offices that will see them, that are comfortable seeing them. If I could start speaking on it or writing articles to give people these tips and these tricks and just things to make them feel comfortable, we can open more doors so that they have more access to care, because that is a big deal. They just don't have that much access to care.
No, I
It
think
is a
that's
heartbreaking
wonderful.
thing.
Yeah, I had a patient not that long ago. Wasn't really exactly sure what was going on, but he was kind of sitting in the corner while his mom was getting his teeth cleaned, and he was just rocking and had to have headphones. And I think it was after I had seen you, and so I was like, okay, what would Lisa do? I didn't know how to handle the situation. I was really intimidated by it because, like I said, all I had known in the past was strap him down, and I know that's not what you're supposed to do. So the main thing I was thinking about is how do I want to be treated? Like, as a
Mhm.
non-neurodivergent person, how would I want someone to treat me? And I just felt like I would want someone to be very direct with me. So when it was his turn, I just sat to him and I said, "We're going to do what you want to do today. I'm not going to sit here and force you to do anything. So if you just want to sit here and talk to me for an hour, that's fine too." And like, I was just incredibly direct with him. He just like looked at me and he was like, "Oh, okay." And then he was fine. He ended up
Yeah.
doing amazing. And it was great, but it was just I was like, "Oh my gosh, that actually worked." Like, I was afraid the mom was gonna be like, "Ah, you're so direct." But I wasn't rude. I was just like, "This is your appointment, buddy. Like, you tell me what you want out of it." And it worked. It went well. So, I mean, I'm sure that's not the best advice, but like what kind of advice would you give to hygienists that are intimidated by working, with special needs patients? Like, what's a good way to overcome that anxiety?
Well, if there's anywhere near you that you could volunteer, like there's a few homes here. So if you could volunteer at a home where you work more with them, kind of desensitize yourself to them so that
Mm.
you see they're not, I hate to say scary. It's not that you're afraid of them, it's you're afraid of hurting them or scaring them. And you can see that they're not as fragile as you think that they are, and you get to see how other people interact with them. Sometimes you can watch the parents and see how do the parents react. Being direct is very good because most of the time they're black and white, and depending on their circumstances, the majority are black and white. And so you being very direct helps them, because that's what they want, is they want to know exactly what you're going to do, what we can do, or what we can't do. Some people say don't give them a choice, and that can be a bad thing and that can be a good thing. I kind of work it where I'll say, today we're going to take some pictures of your teeth. Okay. So I've told them what we're going to do, and I let them feel like they have a choice. Most of the time they'll say, okay. Sometimes they won't. I said, okay, well, let's start with other pictures. We're going to take these pictures of your teeth today. Let me show you. And so I give them a little bit of a choice and not a little bit of a choice. So it just depends on what we're doing. Like I won't use scalers, I won't use sickle scalers if they move a lot. I'll use curettes because curettes are safer if I can do that. Sometimes it's just polishing. Sometimes it's just brushing. The one that I was talking about where I have to hook my thumb, for a while, it was only brushing. And it was a struggle to brush his teeth, but I could get in there with the brush with my light and everything else and maybe have help. And I could brush him better than his parents were able to at home. And then I was able to work with the bite block, and now I can scale him a little bit. So it's a lot of the trial and error. Don't be afraid that you're going to hurt them, but don't force anything at the same time. So if you force it, or if you're gruff, that's going to go the wrong direction. Have a positive attitude, smile at them, just be upbeat in your manner. That kind of sets them at ease too. So kind of like a baby knows when you're afraid, when you're holding them, they may not understand what's going on, but they know something's not right. They know you're not comfortable, or you're scared, or you're angry. Even if that's not really what your emotion is, they know something's not right. And so by you trying to be smiling and happy and excited, that puts them a little bit at ease. And then maybe you can get a little bit more done.
No, I think those are really, really helpful things to just think about and just to have in the back of your mind as you're trying to build your exam and how you want to do things with patients that might need that extra care.
Yeah.
So if people are wanting, like, I know you had mentioned working like in volunteering locally and like maybe some public health settings and stuff like that, you can have more exposure to special needs patients.
Mhm.
Are there any other really good ways that people can learn about, special needs care? Are there any other classes or anything that you suggest?
And there's always some classes online. Like I've got some coming up in some certain areas. Smile Source Convention, which is a group of dentists come together. I'm speaking there. There's the Special Care Dentistry Association, which I had never even heard of, and it's been around for over 30 years. So it's been around a very long time, and it's like all over the world. So people come from, last year I met people from New Zealand and India and Israel and the UK. So they come from all over for these conventions, but they've got good information online. I think Colgate had one you could watch. I have some that I'm going to be putting up hopefully before the end of the year. I've also got a book that I'm going to put out that's supposed to be in the next 2 weeks, a small little book that's going to come out that gives you like a brief overview of the 5 most common ones. And then at the back will be a quick reference when you're have somebody scheduled in, that you have a Down syndrome patient scheduled in. You can flip back and go, here's some things that you could try that typically work or don't work. So that way it's like a little quick reference of what you can and can't do. But just as much continuing education as you can, as much as you can.
That is so cool that you're making a reference book for that. I just want to throw that out there. I definitely want that because, like I said, I feel like I need that kind of a thing. So,
It's going to be small.
congratulations, though. Like that's huge steps of something that, first of all,
Yeah.
I've never heard of, something that's helpful to me. So it's like you're putting out this amazing content that's going to be so helpful to not just hygienists, but the special needs patients that they're treating. They're getting some really great help and advice from you. So congrats on doing all of that and
Thanks.
putting that out there for people. That's incredible. The association that you were talking about, what exactly do they do? I had, like, we said we hadn't heard of them before. So what all do they do?
So it's a nonprofit organization. So it's a little different in some of the other type of organizations. They have a yearly conference, and in it they have 3 tracks. So they have a geriatric track, they have a hospitalization track, and then they have the special needs track. So depending on which way you want to go, I like to do the special needs and the geriatric because I also work with dementia patients as well. So if you were to go to their courses, they have, I think it's 20 something hours during their convention,
Wow.
where you can get all kinds of stuff. A lot of it studies that they've done, because a lot of it is educators from all over the place. So there's actual studies that the students have done. So you find a lot of stuff out before it comes out. And then special clinics that they've run that run differently than what we have here, or a pilot program. So it's really neat that they have that online. They have the Helen Journal. So the Helen Journal is one that it's not just dentistry, but it's all about special needs and medical. So it's from the medical side, the dental side, and also from the patient side. It's an online magazine. It's really pretty cool. There's some neat stuff in there as well. Just if it helps you to get involved, if that's what you're interested in. If you're only going to see one patient here and there, it might not be, it might be more than what you need. You might not need to do that. But just, to me, continuing education, I put the articles out just because there's not a lot out there. So if you can get more information out, the more you read about it, the more you learn about it, the more likely you're going to feel more comfortable, or say, okay, I can do this. I can try this. This is what was suggested. Let me see how that works. And once you do a little bit, you start to become more comfortable with it. And then it just grows from there.
I'm curious, do you have a recommendation of like products that offices can carry, like comfort products? Like 5 things, like weighted blankets, squishy toys. Like, what would you say, like, just a basic office general practice should keep for the neurodivergent patients?
So fidgets are really good. So a lot of things they may bring with them, but it's always good for you to have them. So fidgets are really good, several different kinds. I have the fidget spinners, the little, and I've got them all in another room. I don't think I have any in here, but the little bubble things you can turn upside down so they can watch them. That's calming for them. Weighted lap pads, weighted blankets are good. So it depends on where you're at. So like in Texas, if we were to do a compression that we did, like there's one called a butterfly wrap, and it's in the back of the chair and it wraps around them like this. It is not for restraint. It is for stabilization. But in Texas, it could be considered restraint. And so if we were to do that, we'd have to have specialized training for that. We don't want to restrain them. So we don't do that. But if they had their own compression vests, those are kind of weighted compression vests. If they bring their own in, it's fine. Those are good for them. Most of them will bring in their own noise canceling headphones, but you can buy, I think, $10 on Amazon, a pair that you can wipe down if they forget theirs or something's really bothering them. We have TVs on the ceiling, so that way when they're laying back, they're watching the TV, so that helps. You can also bring them into alternative entrances if you have one, bypass the waiting room. That if you have that capability, a lot of times we learned during COVID, you could wait in your car because you didn't have a choice. But that worked really well for a lot of them because they didn't have to see all the people in the waiting room. We could call and say, okay, we're ready, bring them straight in, and they bypass all that noise and all that chaos that's just overwhelming to them. Let me think. There's other things that you can offer. There's the Samba brush by Curaprox. It's a really cool toothbrush. It's kind of U-shaped and it travels like this. So if the caregiver is the one brushing for them, it's nice, thick. I think it's underneath my computer actually, but when you put it in, you just put it in their mouth, you hold it still, or they can if they have dexterity issues, and it moves. So I tried it myself before I recommended disclosing tablets, all that kind of stuff. I'm like, unless I try it, I'm not going to recommend it. It worked really, really good. And then you flip it over and do the other arch. I like little triple brushes, and the triple brushes are, there's 2 different kinds. So there's one that's a manual, and so they go in and they go right here. So that's doing all 3 surfaces at the same time. And it's just a manual toothbrush. Then there's an electric one called the triple brush, and it's on Amazon. I think a dentist and hygienist put it together. My kids have that. In fact, I bought it years ago for my kids. It worked really well. I make little desensitizing kits, and these desensitizing kits are not for desensitizing your teeth, but for your sensory issues. So I haven't come up with a better name than a desensitizing kit, but I need something cute. So if you think of something, let me know.
Comfort kit.
Maybe so. So it's all the stuff that we would generally use in a like a regular cleaning visit, so that they can take it at home and practice. They have practice visits, their bibs, their gloves, the mask. The parents can be the dental hygienist, dental assistant. I've got a mirror in there, a bite block so they can get adjusted to a bite block. I've got a fluoride tray, which I know people go, why do you have a fluoride tray? But you can take apart the fluoride tray and they could practice holding something in their mouth if that maybe they're going to have to take an impression, so they can practice. Are they able to get something in their mouth and hold it there and longer and longer? You could even give them little bits of amalgam to take home. Not amalgam, sorry.
Oh, I was like, what?
No. Yeah, I don't know why I said amalgam. Little bits of impression material. I don't know why I said amalgam. I haven't used amalgam in forever.
I don't either, but it made sense until I was like, wait a second.
Yeah. So give them a little bit of the impression material and let them mix it up. Make like a little ball. I'm not talking fill the tray, but so that they get the taste and the texture and the feel. I've got Profi paste and a Profi angle so they can feel what that's like in their mouth, because it's a lot of taste issues, texture issues. So they get to test all of it, and they don't have to use it all in one sitting. Like they do a little bit each day, kind of working their way up to it. For some kiddos, that works great. Some it won't work at all, but if you don't try it, you don't know. And if it worked, now they can come into the office and do it. So I have those kits that I've put together as well.
That's so genius.
I've
never heard of that. Like, it makes perfect sense.
Yeah.
I mean, we tell patients, bring your kids in so they can get used to the sounds, the smells, all that stuff. Well, why not be able to do that at home for these special needs patients? Like, that just makes sense.
Yeah. I've even had them where they come in to desensitize them to the office, where they come in and they're in the waiting room and I come out and say hi. They're there 2 or 3 minutes and they leave. It's not a visit. We don't do anything. It's just see the office, see the sounds, see the sights, see the smells, see us. Then the next time, maybe we'll take them to the x-ray room or maybe to an operatory. We don't do anything. It's just a quick 2 or 3 minutes. So it's not a matter of, okay, well, we're giving up all this production time. It's a couple of minutes.
Yeah.
It's just a couple of minutes is all that you're doing. And you get them further into the office each time so that then they're able to see different parts of it, see you, see the front office, see the dentist, see the assistant, kind of start to put things together. And if you have access to teledentistry, you can even do some of it with that. So they're at home and they're getting a tour of the office, or they're getting to say hi to some people. And then you bring them in. Oh, I've seen you before. I have seen you. So again, so much of it is tailored specifically to each person because they're all so unique and their needs are all so unique that you've got to figure out what works for them. A lot of conversations with the caregivers or parents first. I have a whole sheet that I send out first before they come into the office. It's probably, I think it may just be 2 pages long, but it has all these questions about their sensitivities and meaning sensory issues, sensitivities. Is it lights? Is it sounds? How would you rank it? What's the worst? What's been successful in the past for the office? What has not been successful? What is home care like? Is it successful? What do you use at home? All these questions, and most of them don't mind at all answering all those questions. It seems like a lot, but they know that you care and they know you're just trying to do what's best for their child. And so most of them don't give me any problem answering those questions. And if they'll do it ahead of time, I know coming in some things that I am not going to absolutely ever try on them, and things that's like, you know what, we can try this and see how it goes. So
I was going to ask you about light. Like, is light sensitivity common, or is it just a variant?
It's a variant, but it's not uncommon. So we always provide sunglasses for our patients. And there's a couple things you can do. So you turn off the overhead, like meaning the ceiling lights, and put the, what all the teenagers are putting in the rooms, the little LED lights around the rooms. So you can put those on and turn them down if you have loops. Or not use the track light either. Sometimes I haven't had loops until a couple weeks ago. That was the first time I've ever had loops. So I did not have that option. And our setup is a little weird that if you turn off our actual ceiling lights, it turns off our track light. So I didn't have that option. So we just did sunglasses and they were okay with it. Sometimes they would put like a paper towel under and the glasses on.
Yeah.
Whatever works for them. Now I'm using loops and just blinding everybody, but I'm learning.
And it's the best ever. And there's times where you're like, I wish this was even brighter.
Let
Well,
there be light.
I'm still using the track light. It's like I need both.
Oh. I really foolishly have not invested in the little laser light for my loops. I need to, because when I go from my loops and that wonderful beam of light to my track light, I'm like, I can't see what I'm doing. I can't see anything right now. It's ridiculous. I need to see right now.
I'm so used to the color of the track light that when this one's more white, I'm like, nah, it's the wrong color. I need this color back on.
That's funny.
But they're used to me using it. So, I'm hoping to get away from that. So it'll be a little bit better for them. But I haven't had too much issue. But yes, we do the sunglasses for that reason. Yeah.
Gotcha. No, that makes a lot of sense too. I mean, I personally sleep with one of those like eye masks that like I can't have any light, like just so that might even be something to have on hand too if somebody really needed like full blackout, because that's how I am when I sleep. But okay,
and
so
some of them might like it.
right, exactly. That might be nice and just like comforting. But I know you said that you were coming out with like a little book coming up and stuff like that. Where can somebody purchase that?
So it's supposed to come out by, I think, the end of the first week of September, and it's going to be available on Amazon. It's called Unlocking Smiles. So
what a beautiful name.
I know.
Oh my goodness.
So that should be out, and I have a website. So it's just simply my name, Lisa Curbow, rdh.com. So my speaker pages are on there that kind of talk about it. And I should have a link to the book on that when that comes out. I'm also going to I'm setting up some storyboards. So I don't know if you know what storyboards are. So people who are nonverbal, either use an AAC device, which is like an iPad, and I made one so that I can take it to courses and show people who've never got to play with one. But an AAC device, or the low tech version is storyboards, where you have like little cards that say brush teeth. So you can give them an order. We're going to brush our teeth, we're going to rinse, and then we're going to spit, and then we're going to use tools, or whichever order you're doing whatever in. So you can make like a little storyboard. So I'm going to have some of those probably on, like, I don't know how I'm going to sell those yet, maybe Etsy or something, just so you can download them. And there's pictures, because some kids do better with pictures and some do better with graphics. So there'll be a couple of options so that you can figure out what works best for you. Parents can use them as well as they're trying to help them learn stuff. It's also really good in dementia as well, because they start to forget, what order to do things in. You can lay it out in order. Here's step 1, here's step 2. And so a lot of the autistic kids, they need an order. They need to know what order am I doing things in, so that you can have these. So if those are on Etsy, which is probably where I'm going to end up putting them, then I'll put a link on my website for that as well. But I'm also on Facebook. I'm on Instagram. I do goofy stuff on Instagram and TikTok as well. All of it's in my name. I tried to make it as simple as possible, just Lisa Curbow RDH.
We will definitely make sure that we promote that, because that's a resource that we all need. And you are a saint. You don't get paid enough for everything that you do. I can guarantee it. Like, this is so above and beyond. I mean, this is care to the next level. And it doesn't surprise me that you have patients driving 4+ hours to have care delivered. I mean, this isn't just like you said, like strapping people in and getting it done. This is care. Personalized individual care. This is what we're about. So thank you for sharing. Like, thank you for everything that you're doing on a daily basis to provide care for patients.
I enjoy it. I really do. It's heartwarming. Teeth are my jam. I think they're all our
sounds like
jams.
people are too, though. So you have like that
people clearly are.
heart and passion that puts both together, that makes you that exemplary hygienist that people just we need in this community is your expertise. So thank you so much for sharing all that. If you could kind of go back to, that very early dental assistant all those years ago, what advice would you give yourself?
Take as much continuing education as you can, visit other offices, ask questions, and work with all ages. It's really cool to be in pediatrics. It's really cool to be in perio, but the fact that I'm being in general, and I'm not saying you shouldn't be in those because I've been in perio, but being in general lets you see so many different things that just at least get good exposure to everything and meet other people, meet other hygienists. I mean, there's still products. So like I went to a class in January that was about special needs, and they talked about a mold gag. I was like, what's a mold gag? I've never even heard of that. It's and it's in another room, but but it's this little scissor looking thing that you put in if they won't really open. You put it in, it stays outside their mouth instead of a bite block, and you squeeze it and it opens and they just bite on it. It's soft, it's silicone. Never even heard of it. My dentist had not heard of it either. So I've been in dentistry 28 years and I still find stuff all the time I've never even heard of, never even seen. It's like expose yourself. But the more you meet people, the more you find out things you've never heard of, you've never used, and techniques you've never tried. When you're just kind of in your own little world, you get in your own world and it works. But there's so much more out there that could help you be better at it or go faster at it or be more efficient in the same amount of times. It's just a whole new world when you start meeting other people from different areas.
That literally has been what this podcast has been for me. When Joffrey even just like threw the idea out there, I was just like, okay, sure. And it literally has been like a personalized continuing education course every week that we do for each other, because you're talking to somebody that's passionate and basically specializing in something, and you get to pick their brain for an hour.
Yeah.
It's I have grown as a hygienist just from getting to hear from our guests every week. It's really amazing. So completely true at what you said, especially about conferences, because that's really where you get to see the products, of course.
Yes.
But yeah, it's amazing what you can learn. Absolutely.
Mm-hmm.
So, well, I think we are finishing up with 2 last questions, unless there was something else that we needed to cover, Nicole.
No, I think you covered everything beautifully. Any question that I had, you went above and
Yeah,
beyond,
you
and
were the best guest ever.
seriously.
Okay. So, Nicole, do you want to take the first signature question that we are going to end with? I'll do it. I'll do it. Okay. So we like to end the podcast with 2 questions. First question is, if you could go back to hygiene school and learn something that you weren't taught, what would that be?
Ooh, that one's a hard one. There's so much out now that wasn't out then. So lasers is a big thing because there was just no lasers then. There just wasn't. And so even though I don't use them much on my special needs, I believe in my laser. That's a big thing.
Do you use a laser with you said you don't use a laser with your special needs?
Not much because of usually I use it more with my scaling and root planings than anything. And because you have to be so precise with it, as far as if they're moving all over the chair, it's really hard to use it on them. So I've used it on a few, but not very many. Not very many.
Okay. I was curious. I was like, I mean, why not? But of course, safety.
It's the movement part. Yeah.
Yeah. Okay. Second question. What piece of advice do you wish you can go back and give yourself as a new grad?
Start learning about special needs earlier. Start spreading the knowledge earlier, and just really get out there and start opening your world. Definitely start opening your world up.
Yeah. No, that's good, solid advice. Well, Lisa, we look forward to hearing about your book when it's released. We will definitely promote that because that is a great resource for all of us out there. Thank you so much. Yeah.
I can't wait for that book. I'm excited.
It's like a pocket book. It's not very big. It's a pocket book.
That's okay.
That's the whole point, is so that you can flip through to whatever you need real quick.
I don't care if it's a pamphlet. I want it. I'm ready for it. Like, okay. I'm telling you, your advice is so incredibly valuable. So I'm excited that you're finally getting all of this out where people can absorb it, take it home, put it in their ops, and just really use it, because your advice is so incredibly valuable. So thank you so much for coming on and kind of sharing some of that advice with us and helping us understand a little bit more about care for special needs and, places that we can go to find resources when we're struggling.
Thanks for
Yes.
having me. I had a great time.
Absolutely. Well, have a wonderful evening, and we look forward to hearing from you in the future.
All right. Thank you. Y'all have a good night.
Bye.
Bye.
All right.